All right. Hello, everyone. My name is Andrea Fletcher, and I'm greeting you today from Health and Human Services, the HHS office in Washington, D.C. I'm the Chief Digital Strategy Officer and Director of the Digital Service Team at the Centers for Medicare and Medicaid Services. I came into the government about 3 years ago and have been at CMS the whole time. So, working in healthcare and public health in the federal space, and I've really just loved my time here so far. So, thank you all for joining us today for this fantastic panel about how to have the most impact possible when joining the government. We have some wonderful panelists with us today. Um, before I introduce our panelists, I encourage you all to drop your questions in the chat as soon as you have them. We have some time at the end in which we'll go through them all. But if we see some that are really relevant as we're chatting, I'll try to pull those in as well. So let's go ahead and dive in. So I have three amazing panelists today, and each of you have held executive positions both in well-known tech companies and have also are currently serving in, or have recently, or have joined the government in the past, or recently here. And we have hundreds of people here today who are considering a transition from tech to government. Many may not have considered the nuances between tech and government. So I'd really love for you to share some of your experiences and insights. So maybe if you could each briefly introduce yourselves. Shannon, I'll start with you. You were also at the digital service team at CMS in the past, and Natalie, so three of us. But Shannon, I'll start with you. Do you want to go ahead and give us an intro of yourself and how you define public interest tech and your experience of tech both in the private sector and in the government?
Yeah, totally. I'll do a kind of overview here and then we can come back to any pieces that are interesting. So, Shannon West, I'm currently Chief Product Officer at a healthcare IT company called Datavant. But prior to joining Datavant, I was in a role that's a variant of the role that Andrew's in today. Things in government, when it comes to digital service, change fast and there's always opportunity to grow. So, at the time, my dad was executive director of the digital service at CMS and HHS. And I was really fortunate to lead a team that was focused on everything from how CMS can better share data to support proliferation of standards like FHIR or FHIR, Fast Healthcare Interoperability Resource. If you're not familiar with healthcare data yet, you will get familiar with that term. But also spent time at the U.S. Digital Service in general, working across a variety of agencies, specifically starting on all things related to procurement. So another thing that you learn quickly in government service is like how you contract for and buy services or buy products defines how successful basically any projects are, because most things are supported by contractors. So prior to joining U.S. Digital Service, though, I had also spent kind of early in my career as a contracting officer for an agency called the Indian Health Service that provides care to about 2.2 million American Indians and Alaska Natives. I come from a family that has spent a lot of time in public service. I have a mom who's a former federal CIO, CMIO. For me, I think I was always like taught that we should show up to make things better if we're frustrated with them or if they're not working. And I remember when I applied to US Digital Service, it's because I was working for a contractor on a RFP or request for proposal that specifically asked for comments around the US Digital Service playbook. And it was the first time I saw it. And I was like, oh my God, these people are going to like change the way the government works. And so I was really fortunate in 2016 for someone to be like, heck yeah, Shannon should show up here and work. And I had the ability to do that. And, I've since transitioned out to the private sector, but at some point in time, I always tell people like, I will definitely be back in government. It's probably my favorite job, the most important job, and one of the most impactful jobs that you can ever have.
Natalie, you want to try and follow that up?
I don't know how to follow Shannon, which has been a pattern in our last decade of working together and being friends. My name is Natalie Cates, and I was most recently the CTO of the COVID response for the White House. Before that, I spent most of my career doing product management, particularly new product development in the health tech space, and have been in and out of a variety of startup and middle-sized health tech companies. It's funny, we're sitting here talking about government. And I think, Shannon, your comment about how it's the best job ever, I think in a health context is doubly true, because one of the biggest transitions for me coming in to government, and I originally came in at the beginning of the United States Digital Service back with Shannon in 2016, is that in healthcare, for most companies, you're playing by the rules by the government, and when you work for the government, you are setting the rules, and that difference and that change is really impactful and a very different way to think about your role and the work that you do. So I'm excited to talk more about that and other things with this group, and I'll hand it over to Matma.
Hey everyone, glad to be here and to be speaking with you all. My name is Mamta Parak, and I'm the Chief Population Health and Data Officer at the New York City Department of Health and Mental Hygiene. I've been in this role and in government a total of 7 months. And so I'm in my honeymoon period, still, drinking through the fire hose and learning a ton about how local government works and how public health works. My background, I'm actually a technologist by training, studied engineering, worked as a software engineer early in my career, and then have been in healthcare now close to 20 years. Initially worked on building analytic tools, decision support tools to help manage drug development pipelines and launch new life sciences drugs in markets. So worked across 30, 40 disease areas over the course of 7 years. In the last 10 plus years, I've been building tech-enabled health services companies, so really health tech from the ground up. So I'm used to being in the 0 to 10, 10 to 30, 30 to 100, and 100 to 400 scale companies and building them from the ground up. So that's sort of my background. I made the transition. I live in New York City. I've lived in New York City 10 plus years now. And I made the transition into government largely inspired by the scale of work at the local level that I could take on in New York City and nowhere else in the world, really. And partly the scale of the impact, when you're in that early stage to growth stage startups, you're sprinting and you're building your technology and data backbone, and you're bringing your first, patients and customers on board. And the scale can be a little elusive. And then as soon as you start to sort of scale, the pressures from your early customers or your early investors to go after the numbers can sort of start to seep into your mission of the organization. And so, the transition to me in public service is like a little bit freeing in that you can they say here in New York City, public health is, it's not a sprint, it's a marathon. And I can feel that, like you're doing thoughtful work, you're thinking about the long-term change, and policy, if impact on not just like daily lives that are around you right now, but also the future of the city that you're in. So for me, that's highly motivating and a really welcome change.
Thanks for those wonderful introductions, everyone. So, we have a room full of people here who are thinking about making the pivot from private sector into public sector. And the question here is like, I think for me, it was more of a why not? Like, why not me? Why can't I come in here and help fix this? But would love to hear a little bit more about like why you decided to make that pivot. I don't know. Natalie, can we start with you? Mix it up a little.
Yeah, of course. I feel like I have maybe a bit of a unique story, since Shannon and I were both so early at USDS. I mean, I got a call from a friend of a friend, and then got put in touch with Mina Shung, who at the time was trying to start up a health team at early USDS and is now the administrator of USDS. And the big thing that attracted me was the people. Like, I had an hour conversation with her, and I just thought she was amazing. I talked to a few other people on the team, and I just couldn't turn down an opportunity to work with that group of people, even if it went well and we didn't actually accomplish any of the things that we thought we were going to accomplish. Obviously we did, and the federal government and state government looks a lot different now than it did a decade ago. But for me, the people were the biggest why, and I find that is still one of the biggest things that keeps me in government. There's just something about someone who is willing and interested in impact and in helping folks all across the country. We have such a diverse country, and when you're looking at that from the federal perspective, and even from many states' perspective, you have to care in a way that you don't necessarily across the board in the private sector.
Yeah, it feels like come for the mission, stay for the people. Mamta, how about you?
I'd say two reasons besides the scale of the impact, local work. I'd say public service, it's kind of always had been in my head for a while. When I first moved to New York is when I actually connected with the Tech Talent Project folks. And then, lo and behold, 10 years later, I make my transition into government. So they must have had something to do with it. But for me, I'm an immigrant. I immigrated as a grad student, and working, doing public service is just kind of a way for me to just, deepen my roots in a way and connect with the community in a way that I haven't before. So that's really been a personal reason for me to dive into public service. And then I'd say, same as you all, the people, when I met the leadership team, the executive team here in New York City Department of Health, I looked around me and I saw 80% women, 50% women of color. And so I don't see that in health tech startups. I don't even see that in life sciences boardrooms. So it was a unique thing for me, and it attracted me to come and work in a setting where DEI and equity was not just a word. It was actually what was being practiced.
And what was your why?
Yeah, I think I touched on a part of this, which was like I was frustrated about how procurements were going. Like it was something that I was dealing with as the user of that on the other side, wanted to see it get better. I think for me though, it's also like most people who show up to like even a conversation like this have something that's kind of inside them saying like, I can do more than figure out how to deliver like food faster to someone's house. And maybe you still want to deliver food faster, but you want to like figure out how you're reaching people who are on food stamps or need food from the food bank. You're not just thinking about how I can pay like $3 for the priority delivery charge, right? And there's no better place in the world than government to show up and make an impact for people that need it most. And also like not just people that are on safety net programs or individuals that we think of as really being disproportionately underserved, but also just general experience of everyone and distrust in government that breeds from that experience, right? Like people don't get pissed at the government because like nothing's happening. Like people are pissed because they're like waiting in line for 20 hours at the DMV or like have some terrible experience, or they're like, Google does it so much better. Why can't it be better here? And so I think that is this huge part of like the first part of showing up is like, do you care enough to want to make a difference? And then I think what Natalie and Mamta said is really right. Like then all of a sudden you find yourself in a group of peers that you may have never been surrounded by before. And you're like, these are my people. Like I think about that all the time. So that's a little bit of kind of my showing up, and probably why I'll go back, because by the time I think we're all of retiring age, none of this will actually be that fixed. There will still be problems to solve.
I know, as somebody who's working at Medicare, I often think like, what's my Medicare sign-up experience going to be like?
You have to ask SSA, right? Because they're the ones that actually do it.
Yeah,
Start
yeah.
fixing it now.
Yeah, maybe by the time I'm ready to age into Medicare, it'll be a little bit better because I had an impact on that. So this is a good transition. What's an interesting application of technology that you've kind of seen applying it to social issues in government? There's a lot happening around life events right now in the federal government, and I'm sure New York City has a lot of impact. Share an example for me of something that you've seen really just like trying to address social issues using technology.
Yeah, absolutely. I'm still learning the whole scope of things that New York City does, and am often very pleasantly surprised. But something I was doing right before, maybe I'll dive into that, is we were working with, in a startup that I was helping build, we were working with Medicare and Medicaid populations, and we leveraged data and predictive algorithms to identify groups of people who would have some sort of like common um, ways of connecting with each other, and then utilizing that insight to develop local neighborhood-based social care networks, where people could we could tackle loneliness at the very basic kind of level, and form social networks among people who are often lonely, but utilize that, form those groups in a way that these groups have like peer influence in terms of advancing health behaviors. And so the point of it was, if if I'm 75, my doctor tells me I should be getting mammograms every year and I just don't, or I should be going to my annual wellness visits every year and I just don't. But if my neighbor sort of shares with me at tea time a story about, how she uh, she's alive today because she started getting her mammograms 10 years ago or 20 years ago and found cancer early and is a survivor, like that's a powerful story. And that's going to motivate me to go do my preventative screening. And so utilizing kind of technology in a way that enables this sort of community-based connection building and health behavior change was something that I thought was very cool. I went and worked there for a couple of years. It I guess brought me to my current role, and I see this type of work being done in government kind of all the time. And I'm looking to bring that sort of innovation that sometimes can happen in the private sector, but those same things can be done a little bit kind of in the hard way inside of government. I'm trying to see how I can bring technology and make things a bit more efficient here.
Natalie, I'm sure you saw a lot with COVID. Do you have any specific experiences from that?
Yeah, I mean, I think the biggest lesson I took from the COVID response, and it was really not that different from what I saw, at most of government, whether that's been state or local or federal, is there's all this really cool, fancy new technology, and oftentimes, like, what you need is like a really simple Salesforce application, or just like a website that is plain language, to make the biggest impact. It's really not usually a technology problem. It's usually a process or a people or a regulation problem. There's other things that are making it complex, and I think some of the COVID work is a really great example. The COVID test program, I don't know how many folks here ordered free COVID tests to the post office, but a team stood that program up in 3 weeks over the holidays. And all of the different technical components are like, no big deal. You're like, we put up a static website. Great. Like, we used UPS, USPS, like, built a new version of their ordering system. Like, great. Except that is the very first time the federal government has delivered anything directly to every American that wanted one. And that new pipeline is a very big tool that didn't exist before for any type of emergency response, whether that's COVID tests, whether it could be masks, whether it could be vaccinations, whether it could be something completely random that I haven't even thought about now in the future. It's that type of impact that is interesting to me with technology in government. It's like, it's not necessarily about the technology, but the technology can have really cool impact.
Shannon, how about you? What have you seen?
I'm actually going to pull on something that I think Natalie actually solved this problem, because Natalie and I worked on two very different parts of COVID response. I was in the White House in March of 2020. Paint your own picture of what that looked like. And at the time, we were trying to stand up a website to help people access testing. And I remember after like 3 or 4 days of like not sleeping, working on this, we've got a website we're going to launch, and we realized like we only have data on 25 testing sites. And so if you're, I don't know, if you're in the US and you're like putting in your address, I would put in random zip codes, and it would be like nearest testing site is 1,500 miles away. And I was like, okay, I definitively know that that's not true. It's just like a straight data problem. Like, it's not about the technology. It's not about whether or not the testing, this was late enough in March, so like testing existed. Like, it wasn't about whether or not the testing was there. It was like, as the federal government, we do not have the data on every testing website because it is a state and local based response. And like, I think eventually like Natalie and team ended up solving this, and then ended up solving it again for vaccination. But it's like one of those examples where we didn't have what we needed early in the response. We didn't know what we needed. And I think like more people would have gotten tested, maybe. I think at the time also like recommendations for testing were a really limited subset of the population. But like, I think COVID response is just in general such an interesting thing to look at in terms of like what could be done differently, and like what are the pieces that got built in the process that we'll potentially need to reuse again in any sort of piece there. The other thing that's also not a project I worked on that I would like give a big shout out to is like the IRS direct file project. Like, one of the coolest things to get launched. I know
it's so cool.
It's so cool. And there's at least one person over there, Chris Gibbons, who is like, this is the problem he has wanted to solve for like 10 years. And so just like that team, I think, is doing something else, which is really disrupting kind of how government has viewed its role in terms of supporting people in filing taxes. And so I think that that's a really interesting, cool one too, to just point out as something else that's an example of where we can really help to positively impact people's experiences with government.
Yeah, I'll share a little story about my team, which was, we built a bunch of content around mental health and behavioral health with SAMHSA, the Substance Abuse and Mental Health Services Administration. And that started off as like, we need a tool where you type in a zip code and find a provider. And that's actually a really hard thing to build. Like you said, you have to have all the data behind that. It has to be up to date. And we spent a lot of time, I see there's a bunch of like UX designers and researchers in here. We spent a lot of time talking to people, and we realized that a lot of people aren't even to that point yet. They're not ready to seek a provider. They know something's not okay, but they don't know really what their options are. Helping them navigate the health insurance system is a huge part of this. Does my insurance cover this? Are there free options? What should I be looking at? How do I even talk to a provider? We talked to some young people who, whenever I go talk to a mental health professional, right? And we're like, oh, you need to take your ID. And they're like, I didn't know that, right? And I was like, that seems really simple. But if you're somebody who this is your first time going and you might be anxious about that situation, having a checklist of here's all the stuff you need to bring with you from a trusted source, right? Like, here's what you need to know before you go to this visit. People really loved that. And so we built a bunch of content around findsupport.gov and linked it all with SAMHSA. But it started off as like you need to go build this whole, apparatus. And I think the conversation of how that landed of actually if we build that, we're not giving people what they need. And how do you figure out what people actually need and get them that is a really big challenge sometimes in government. So, okay, Shannon, I'm going to go back to you. What assumptions did you have before you came into government about government work? And How did that end up being wrong, or how did it end up being challenged? I'm sure there were a few.
That's a great question. So I had this like really early career job in government when I was just like, a young rebellious kid who like I think often about my boss. He was this guy named Dale Burson, and I was a contracting officer, and at the time it was like 2012, I think. And there was this huge focus on reshaping the way that we did IT procurement. And I remember I would like always just like stomp my way into Dale's office and be like, here's this dumb thing that someone's doing. Can we just do it differently? Like, here's a better way to do it. And I was really lucky that at the time Dale was like, sure, okay, great. You want to try it? Great. Just like, let's not go to jail. Like, let's do things by the book and like figure out how to do it. And I think Dale eventually retired, and then I got a new boss who was basically like the total opposite, like didn't know what to do with me, who was like, I don't want to do things this way. And so when I left government, I left, I think kind of on that low point, right, of feeling like you couldn't make a change, or like you couldn't push through hard problems, or like someone would be in your way to basically say like, like, no, you cannot do it that way. And so when I came back through US Digital Service, and I think you find this in a lot of these places where people want someone who thinks differently, that is not that is now probably more the exception than the rule, to have someone who's telling you no, that you can't do something. Whereas you've got more people who are really supportive of saying, let's look at something differently. I want someone to show up and show me like, what is a different way of approaching a problem, and finding support there. Doesn't mean there's not still a lot of hard work that has to go into convincing people of like why you should do something differently. But, I think I definitely had some anxiety going back in that I was going to meet someone else who would say like, no, you can't do it like that, and we'll throw up every roadblock. And I think that there are just more pockets now where that's not true. I will say the one other thing that I did anticipate that did continue to be true is like, the government still moves a little slow. So like it just, from like how long it takes your computer to turn on every morning. I mean, Andrea, I'll be very curious if like there's less than 5 security scans running at one time that, doesn't take 20 minutes to turn your computer on to like all the random things. And so it's like the set of expectations that you show up with, which are, I don't know, you just move a little differently in government to get things done. So
I usually take timelines and times it by 2, right? Like it's going to take you almost twice as long to get something done. Yeah, because there's a lot of check boxes.
Yeah.
Natalie, how about you? What are your assumptions that were challenged?
It's funny. I was thinking about that question, and I think maybe because I worked on the Hill when I was in high school, like I didn't have and because I already knew people who were working within the digital service, like I got bombarded very quickly with like, here's the real deal. Like I got every negative thing I was going to run into, like was told to me by 5 people before I decided to join. So I think my assumption was that we were going to really be fighting. And it surprised me that there, even a decade ago, were advocates. We ran into people who were Shannon, but still within their, normal federal employment, who just were like, I've been trying to convince them to do it this way for decades, and like nobody will listen to me. They'll listen to you. Like, let me show you where all the bodies are buried. Let me talk you through all the politics of this, but like, I want to support making this change happen. And I was surprised by the number of those people, and I was surprised by how energized they got by at the beginning of the digital service team at CMS, there were 4 of us. Like there were not that many people, but we had the right access, and we were sort of placed in the right spot, and we could make real change. And I don't think I calibrated right how much that change would mean to the career civil servants who had been working and trying to make those changes, pushing a ball up a hill for so long.
Oh, I just want to add one thing in there, which is like, it's not just changes for that program. It wasn't just changes for those individuals. Like I remember thinking about this from healthcare.gov to the day that we delivered the first API for the quality payment program. CMS was a fundamentally transformed agency, and it was something that just continued to snowball. And so like, you might underestimate also the amount of impact that you have going through the door, where you think that you're changing a small thing or a small program, but the impact of that just reverberates for years across an agency, and it sets people up for success inside I'm thinking about like Yadira Sanchez, and like
Yeah.
she is like
Amazing.
a force that was changed because there was this great work happening that could give just agency to her voice and what she was saying.
Yeah. And I think for folks who are thinking about some of these local public health agency roles, I mean, that's really the type of work we're talking about, right? It's like these organizations aren't necessarily large, but the impact you have in one area shows people that there's a different way to work. And the HHS I came back to a decade after landing at HHS the first time was a fundamentally different organization that I didn't really recognize, and I took for granted until I started talking to some other agencies across the federal government that had not had the type of change catalyst that HHS has had over the years, and it's night and day.
Mamta, how about you? What are some of your challenges and assumptions that have been challenged since joining the government?
Yeah, I'd say like I didn't come in with too many assumptions because I hadn't had too much of a brush with inside of the government. So I came with with the intent to learn. But you do have some notions of government is slow moving, and maybe there's like going to be a 9 to 5 kind of culture, which to some extent is true. But what I've kind of encountered is this like passion that like runs through, and I don't know if that's just more public health rather than like the entirety of the government, but the passion that people bring to their jobs here is just phenomenal. And they assume like longevity to the work that they're doing, um, like the personal responsibility everyone sort of brings to the table for any project or task they're a part of is surprising. And so like this is a place where people don't come here just because this is a job. People come here, it seems like, because they have a passion for something, and it really shows through. And folks have, in my observation, folks have also learned to work with what they've got. So they do sit inside a bureaucracy, and people have learned to get things done in the setup they're in the resources they have. Some people have more resources, some areas have less resources, and I see them all like moving forward and creating value from whatever seat they're in. And so that's been a I don't know, welcome, I guess a pleasant surprise for me.
Awesome. Okay. I think we've answered a lot of the questions in the chat. If there are any burning questions, please put them in there. I'm going to ask what I think is kind of a tricky question. But can you talk to me a little bit about like salary and benefit? And like, I think we often hear, oh, they don't make as much money as the private sector, and you're not, or like your benefits, the benefits of working in the government are the benefits, right? You get a pension and a good retirement if you're in the federal government, for example. Can you talk a little bit about that and that transition from the private sector to the public sector, like just the day-to-day, like this is what was important to you when you made this decision. Here's what you looked at when you're looking at public sector jobs to help you understand, the salary and the benefits and the choice that you're making. I don't know if anybody has anything they can add.
Yeah, I think I can jump in first with like one caveat, which is I don't actually know how these roles that people are here that they're super excited about. I have no idea about salary or anything around those. What I do know is like in public sector jobs, there is still a range. So like within the federal government, there are explicitly defined pay scales. You can go to OPM and look up the GS pay scales. They are regionally based. Like very consistent. All jobs on like usajobs.gov will tell you, they'll have a salary range explicitly in there. They do also have a variety of benefits associated with them, whether that be typically pretty fantastic health insurance as a federal employee, to like great retirement. If you want to stay for a long time, pension, like I think I did like 8+ years in the federal government in total. So like I will be back. I will have a great pension, like as I continue my public service. And then I think in addition to that, there is some kind of inflexibility in terms of your ability to negotiate or navigate negotiation, because it is not the same as a private sector job where you show up and you're like, here is X dollars that I'm making today. Here's where I'm like leveled, I believe in this job. Here's what I think makes sense. Like there is some more rigidity to it. However, there always are ways to like make sure that you show up with a clear indication of like how much money you'd been making before. For the federal government, a competing job offer is like often something that also helps people to get additional money. In some contexts and cases, there are things like sign-on bonuses or retention bonuses. They are rare, but like I have seen them in the federal government. The one caveat to this is my mother, who I mentioned before, also is a county level public health director in Arizona. And I know her jobs post for like probably like maybe a third of what some of the federal jobs do. And so if you are considering state and local, I think you should look at salary bands. You should anticipate kind of a lower range there, but also recognize that there are trade-offs in kind of how you make considerations for that work. As an example, like if you wanted to be based in Tucson, Arizona, or in any other town that had like a smaller public health department, there is the ability to do that. And I think in some cases, cost of living is also lower. And so those things are taken into consideration. So all of that to say, like there is a range. For me personally, I think it was mission over money at the end of the day. But I didn't feel like I was not making significantly less money compared to the majority of my peers, with the exception being people who were at large tech companies at the time.
Yeah, I got a raise coming into the federal government. So I always find this an interesting question, but also that it requires some homework, right? It requires you to kind of be really honest about salary and read up and understand how to handle that negotiation, because it is different. You're right. Natalie, Manta, anything to add?
Yeah, I mean, I think I would just reiterate that like it's sort of different for everyone, and some people might think government salaries are low. Other people, depending on what industry you're coming from, particularly, like they could be higher, they
Yep.
could be equivalent, and think about the investment you're making in your career and what you might learn, who you might meet, more than just like what is the paycheck I'm going to be getting. And as Shannon mentioned, sort of once you understand government, there's like ways that you can figure out, earning more money, particularly like, I don't know if anybody here is a lawyer. If you are a lawyer and you get in a lawyer job, like lawyers get a bump, doctors get a bump, DHS figured out a way to have technologists get a bump. So like there are these pathways, but generally, government is public service, right? So like if everybody made a lot of money, it would be in headlines across the media, but you're not going to not have enough money to eat.
Yeah, building on all of what you just said, if you're going to think of this as a long-term career path, I think the long-term benefits, like the pension, the retirement benefits, they just kind of outweigh what you're sort of maybe losing in salary in hand. And I'd say if you're coming in thinking short-term, then the growth this role will, like a 2-year, 3-year stint in the government is going to bring you, is just going to position you for something that you may not have imagined in terms of growth for yourself in 3 years. So if you kind of look at it from both perspectives, it's sort of a win-win, and depends on what you value. Like if you really want no worries about healthcare and a steady pension when you retire, after 10 years in government, that's stay. And then if what you want is fast growth, this is also great for that.
All right, I'm gonna take one more question from the chat and then we'll wrap it up. What advice do you have for recent grads? So if somebody early on in their career who's thinking about a switch to government.
Sorry, hold on.
The dog definitely has feelings about recent grad programs, and that we probably
does.
need more of them.
I'm gonna let the dog out, and I'll be back. Someone else should answer.
I mean, mine is like just do it. Just like get in and figure it out. I part of me wishes I would have done the government, like done a stint in the government earlier when I was younger, but yeah, I would say.
Yeah, I think from my perspective, there's a couple of paths. So like one, Coding It Forward now has like a government program too. Is that true? I think that there's at least like a couple different programs now for kind of earlier career folks, whereas like U.S. Digital Service, it used to be like a minimum of like 10 years of experience. I'm not sure where it is now, but the other things is like Andrew said, just get in the door, because as soon as you're in the door, it is so much easier. I do think there's like some caveats to that. Like, don't take a job that you're going to hate. Like, don't work for someone that's going to make you miserable. Like, longevity in the federal government or in government in general is important. But there are kind of a lot of different ways to consider that. And I think like at the federal level, the job descriptions are non-obvious. Like they never actually are very clear about what the job is. So it might mean applying for like a bunch of things and throwing caution to the wind and just hoping that you get something. But then I also think at a local level, there's a lot of ways too. The other path is working for contractors. Like working for contractors who do work with the government is actually a great path to like get like a toe or two through the door to like better understand what's possible and what's happening there.
Yeah, and I actually that's what I was going to say. I usually recommend to new grads and folks who are early career not to go into the federal government, but to go into larger public sector tech and to some of the contractors, because the reality of the situation is that most places in government just don't have the resources to really do career growth for these types of roles. So you're not really going to get a lot of support. You're not going to have the type of access to growth that you would have in a much more well-resourced company, I would say, generally.
Yeah. I would just say try a lot of things, do a lot of different things. Like don't go, if you go into federal government, plan to stay a couple of years, learn as much as you can, then go do something else. If you go somewhere else, then do plan to come into government for a couple of years and learn. It's just, you see a whole different side of, how the world works and how work is done and so I think diversity in your career is just highly recommended.
Yeah, I would agree with that. So I think maybe to wrap it up, many people jump around. They jump around to different agencies, state, local, private sector, public sector, and that having a nonlinear career path is, I would say, more of the norm. But thank you all for joining. Any final thoughts from our panelists?
Go work in government. Everyone should show up. That's my pitch.
Yeah, I agree. Show up, even if it's only for a year or two, you'll learn a lot and you'll have a different perspective on the country, which I think is huge.
And thank you for just being here and listening.